So then Vanessa is going to go ahead and show you what the plastic cups can do. Oh, we forgot to bring the oil.
We're going to go ahead and use this, So we actually like to use the muscle ease gel. Not only does it feel really amazing, but we can use it for a different kind of cupping called sliding cupping. So that was stationary cupping, right? Sliding cupping is when you want to go ahead and have some sort of gel or lotion or oil that has some friction so that we can slide the cup along, and it really feels like a very deep massage. It really deeply relaxes the muscles underneath. So I'm gonna go ahead and show that with the plastic cups, okay? So I just need a little bit of that. I'm gonna apply it. I'm gonna go ahead and apply it.
Emily, if it's too much, just let me know.
Yeah,
it's not.
She likes it.
Make it harder.
So it's gonna be a little cool.
She wants more.
As you know.
Yes, and muscle ease is the best.
Yes, it feels amazing. Okay, so I just applied enough to give the cup some slip, which you need for sliding cupping. And then I'm gonna go ahead and select a plastic cup, and basically that used fire to create the suction that was necessary to stick onto the skin, right? But this just uses suction. It's just a little bit easier. And you really don't need you don't need too much suction when it's the sliding cupping, because you want to make sure it's okay to move. So as you can see,
and that feels so good.
It feels like a deep tissue massage.
And you're just sliding, and you can see the color coming out, right?
Yeah.
You can actually see it right away.
I can feel my muscles like totally.
Really?
Yeah, you can see it, and it's getting.
Can see it too.
Yeah, it's appearing more and more, right?
Wow.
Yeah.
That's amazing.
Right, and it feels amazing.
And it doesn't hurt. Everybody always says it looks like it hurts. It doesn't hurt.
Yeah. So you just want to do that. You want to get the color out.
Yeah, and she looks like she has some tension if you look.
Yeah, it does.
It looks
More
like it's
so
starting to
here.
turn
You can see
like
more
almost a
here,
little bit
right?
purple. Yeah, you see that? Dark.
So afterwards, you're done with one area, you go ahead and release, and you move on to the other areas.
Did you do the whole back?
And you can do that wherever there's tension on the back.
Oh,
it's darker there.
Yeah, so this side she has more tension over here, as you can
I
see.
carry a lot of tension in my shoulders.
So this is starting to fade already, right? But you can see there's a little bit of.
Yeah, and you can, when you do
worse.
I wouldn't say worse.
I think they're
wouldn't say
both
worse.
pretty-
the same. Yeah.
Yeah, I just traveled yesterday, so that makes sense.
Okay.
I'll do it.
Might even want to do a little bit here.
Your tension is balanced.
It's just interesting because especially with the cups, you can see like if a certain area is a little darker, like that little area right here, that's where more of the circulation is stagnant. And so I'm just gonna show you a little bit on another area of her upper back.
So what instrument was used originally in acupuncture, the plastic or the
This is the old school
Oh,
way.
I see.
Yeah.
So
This is a newer technology. They
I
couldn't.
see.
Yeah.
How did this come to be? Do they know? Like, who thought of this and how did they know?
I know the old way with acupuncture and cupping in general was used when there were like poison, like snake bites or insect bites or whatnot. So they would use the needle first, and then they would suck out.
the
Yeah.
poison.
So I think it kind of stemmed from that concept.
And then they realized it was doing other things.
Exactly.
And you can see it's darker.
Yeah.
She has more along her scapula.
Yeah.
Wow.
So that was right away. That red came out.
Emily,
Yikes, so I really need to come see you.
You need an appointment tomorrow.
and how often, like, do you recommend? I mean, I know
With
that you
cupping,
said with
You can see.
With cupping, if there are marks like this, I would recommend not getting cupping until it goes away. And usually these marks will fade within 3 to 5 days, depending on how serious
okay,
you are.
that's what I was asking.
But with the acupuncture part, I mean, it just depends on what you're coming in for and why. Sometimes twice a week. If it's just a tune-up, maybe once a month. It just depends on your situation.